Deebo Samuel, I'm, as a sports broadcaster, journalism 101, you're not a fan. Every time you're in the press box, in fact, yesterday, and as we taped this on a Monday, when I was in Dallas, they were up 33-9, and the PA announcer had to remind the press, this is a working environment. There's no cheering in the press box. And so we don't cheer, but we're human. and after the 49ers started 5-0, they've lost 3 straight now. And Deebo Samuel is part of the reason they've lost their last 2 is because he's hurt. This is one of the most talented athletes I've ever seen.
Yeah, I was going to ask you, because I saw Jay Glazer also had a comment. This is the reason that they're losing, because he's not just next man up.
No.
This man is not uppable.
Exactly.
What is it, in your opinion, Curt, that makes him so special?
Speed and size. You can't teach some God-given skills. He's got a God-given size that he's a running back that can run like a wide receiver, and you just don't have that. So Kyle Shanahan, who's one of the most God-given brains, and with him and Christian McCaffrey, they just do things. Sean McVay always, before they got Christian McCaffrey, he called Deebo an outlier. And he goes, just like we have an outlier in Cooper Kupp. Cooper Kupp can do things. Deebo Samuel can do things that it's not next man up, because God didn't create a bunch of Deebo Samuels. He might have the same hamstring, the same knee, all that, but what he can do with his God-given speed and his God-given size, and then you put him in an environment with Kyle Shanahan, it's unstoppable, virtually unstoppable. But he injured his shoulder.
Yes.
So what do you know about that injury? Because it's his rotator cuff.
It is not his rotator cuff, but his rotator cuff is adjacent.
Okay.
Just like real estate, where do you live? Beverly Hills adjacent. His rotator cuff adjacent. And his diagnosis is called a hairline fracture, which means the bone is cracked, but it's not pulled apart. We call it a non-displaced fracture. And it almost minimizes, well, why is he out for 4 weeks from that injury if it's just a crack in the bone, it's not pulled apart? And here's the reason. And I brought a model.
And can I stop you for a second?
Yes.
Hairline fracture. I've heard that. How do you, is that from a hit or is that wear and tear?
It is not wear and tear. It is totally always related to trauma, to a hit.
Okay.
And I brought a model, which we'll get into in a second. And actually, before we do, I'll do the model right now. When we're talking about a hairline fracture in the shoulder, and that's all they've released. So your shoulder has 3 bones that are hairline possible. Your collarbone is part of your shoulder.
Okay.
Bone in front, the clavicle. The top of your shoulder represents the front of your shoulder blade, the scapula, where the socket of the ball and socket joint is.
So that would be on me here?
Right here on top.
Okay.
And as you mentioned before, what lives right deep, you can't feel it, but I'm showing you a picture here, is the rotator cuff. This is the rotator cuff adjacent, which is the acromion on the top. So clavicle, the scapula, acromion, which is part of the scapula. So that's 2 of the 3 bones. And then the final 3rd bone of the 3 that make up your shoulder is the humerus, the arm bone, where the rotator cuff attaches. So one of these 3 guys is fractured, cracked, not displaced. They haven't revealed which one. He got hurt. They did an x-ray. Negative. They did an MRI, negative. And then they did the ultimate to really see a fracture in all its forms, even tiny little cracks, a CAT scan, which is a 360-degree x-ray. And on that, because he had persistent pain, that's why they insisted on doing the CAT scan. Then they noticed the crack. But it is not the reason that it's just cracked that he's going to be out 4 weeks. And this is what I want the Weekend Warriors to appreciate. Look at all the tendons that I have here that are this brown attaching to the different bones. So Eli, let's go to some Klapper vision.
Producer Eli working overtime to get that.
Right. So the boat, the dock, they're like two bones, if you will, of your shoulder. The rope that attaches the boat to the dock so it doesn't float off into the lake here is the tendon, the soft tissues, if you will. Athletes, patients, weekend warriors who rip the rope, they are at risk for the boat floating away because there's no longer a connection between the boat and the dock. That would be a soft tissue injury, a tear to the tendon to the rotator cuff.
Would you, if that were the case, would you surgically repair that?
Yes.
Okay.
Yes, you would be surgically repairing that.
Okay.
And that would be something we would see on the MRI. But what else could happen to this boat, rope, dock story? Next. So Eli, let's go to the next photo. And in this photo, you have a close-up of the rope attaching to this metal prong, which is attached either to the boat or to the dock. That is the equivalent of the tendon of, for example, the rotator cuff attaching to the bone. We talked about the rope being ruptured, but what else could happen if you bust the wood where the cleat, that metal prong attaches? Now you're still at risk for the separation between the tendon. As the boat tries to drift away, it's not because the rope is ruptured that it will be disconnected. It's because you busted the wooden or bone attachment of the tendon or the rope.
Okay, so 3 years ago, I'm riding my mountain bike, and I'm at the end. It was an epic mountain bike ride, by the way, Dr. Klapper. And as my buddy said when I fell, probably the wrong time to tell you, but you were hauling.
What?
And I go to the bottom, and literally, it's 20 yards and we're done. And as I hit the soft dirt, I crash. Now, I fractured my left shoulder, the big ball joint. What is that?
The humerus.
The humerus, okay? And there's a crack in it. You can see. Before I went to the doctor, I'm like, I broke my collarbone. I mean, I thought I'm going to be in full surgery, and shows maybe I'm a little soft. It was, honestly, it was the most excruciating thing. I couldn't move my shoulder for 2 weeks, and all it was is a crack in the humerus.
That was a hairline fracture, which Deebo Samuel could have had, or that could be the bone that they're talking about. But the reason he's an elite athlete, like you just pointed out, but the reason he needs to be held back, the bone will go on to heal just like in Curt Sandoval's
by itself. That's where it's going.
But what will prevent it from healing is if the rope keeps trying to pull on the cleat that's broken. If the tendon continues to pull on the crack, the hairline fracture, it is a deforming force that you need to keep quiet in a sling, not move it, so that you're not making a hairline fracture, a non-displaced fracture, into a displaced fracture, because then we have to operate.
Okay, so let's step it up a little bit. You said, hey, the MRI was negative, the X-ray was negative, and then they do the CAT scan, this three-dimensional image that really shows it. Is that, give me a little bit more on that. Does that mean it's deeper and they couldn't see it, or is it smaller? Does that reflect to you anything else when you hear that?
The CAT scan, well, let me think of a good Klapper vision for you. When you ride in your car, they will say you got to be careful because you'll have a blind spot.
Right.
You've got your rear view mirror, you have your side mirror, and yet there are many people who move lanes. Yep. They move lanes, bam, and they hit he's in that one spot that the rear view mirror and the side mirror don't see, and you smash into the guy on the right-hand side because you try to pass someone on the right, and you should always do it on the left. It's POV, point of view. Well, an X-ray, even if we get 2 views, front and side, 3 views, front, side, and diagonal, that's just 3 views. But a CAT scan gives us every view. So the eyes don't see what the mind doesn't know. You can be told on these 3 views, we don't see a crack. Deebo Samuel says, my shoulder hurts. It's killing me. You got to get me a better test. Let's get a test that there is no blind spot. That's a CAT scan with an x-ray with no blind spot, and that's why you see it.
So one of the things that is in my simple athletic mind, the weekend warrior mind, if you will, is if Deebo Samuel is hurt from this, and you're telling me, hey, so these ligaments don't create a bigger problem and it's immobilized, which they're surely doing, is how do they know when enough rest is enough rest? If it's 4 weeks, what if he comes back in 4 weeks and it should have been 6 weeks? What if 4 weeks was enough and he doesn't come back in 6 weeks?
Again, depends on the location of the hairline fracture. The other question you might want to ask me is, when he does come back, will he be 100%?
And that was actually what I was going to say is, are they? I was going to ask it in a way, are they concerned that it's football, he's gonna take another hit?
So he for sure will have some weakness because he's injured, and you have to rest, and therefore the muscles are not firing normally, so they're going to atrophy and weaken a little bit. But here's the beauty of it being an upper extremity injury. He can still get on the bike. He can still stay in NFL aerobic conditioning so that when that 4-week timetable is up, he'll come back with endurance and aerobic conditioning. He may be a little weaker, but my opinion is when he does return, he will be pretty close to 100% Deebo.
I want to, because, and Eli, if we can go back to the photo of Deebo, we talked about, I mean, you can just see the physical nature of this man. He is a physical phenomenon. And as are most NFL players. Most NFL players are in great shape. What he can do with that. You mentioned he could get on the bike. Would you wait all 4 weeks before you just put a football in his hand like that at practice and he's running cones?
Pain will be a better indicator. Pain was the indicator that your studies are wrong.
Right, with the X-ray and the...
And same thing is true. Before the gluing, let's use that as a term for healing a busted bone, before the Elmer's glue is hardened, while it's still that white, moist stuff, but then it becomes a little sticky until it becomes clear and is permanent. As the healing bone called callus is not mature yet, it's not the clear Elmer's glue, it's still white, you have enough connection. Pain-wise, you may say, my shoulder doesn't hurt. And we won't see the healing bone callus, it's called, on the x-ray yet, but you will say it doesn't hurt anymore. That would allow me to say you can hold a football and go run.
All right, so I'm a sports guy. Clearly, Dr. Klapper is an orthopedic surgeon, so let me do the translation for the football fans here. Keep him on your bench for 2 to 3 more weeks and go pick up a backup. All right, that's Deebo Samuel. I'm Curt Sandoval with Dr. Robert Klapper. This is the Weekend Warrior Podcast. We're going to come back, talk a little Kirk Cousins in just a minute.